Action Africa International (AAH-I) is a regional non-profit organization that has been providing high-quality community development approaches in fragile and emerging states across Africa for over 20 years, working in Kenya, Somalia, South Sudan, Uganda, and Zambia. In recent times, we have expanded our activities to work with other marginalized communities that have included pastoralists and communities living in urban slums. Our organization was created by a group of humanitarian aid workers from Africa who at the time were working in deep South Sudan with refugees displaced by the civil war that was going on. The organization was originally set up in Munich, Germany as Action Africa in note EV-AAIN to later be replaced by Action Africa Hilfe EV in 1996. In 2003, our founding chair, the late Dr. Chris Wood, and colleagues moved the organization from Germany to its present headquarters in Nairobi, Kenya, bringing us closer to the communities we serve. In the many places where we work, we are driven by our mission of supporting livelihood-challenged communities to sustainably improve their quality of life. From humble beginnings in South Sudan, we have successfully expanded our work into Kenya, Uganda, Somalia, and Zambia. We have built a track record of delivering high-quality interventions and much-needed healthcare services in places where health systems and infrastructure have been devastated by long-running conflicts and where the key health indicators are among the worst globally. Our efforts have helped nurture a successful primary healthcare program in South Sudan, laid the groundwork for an effective health system in Puntland, Somalia, and assisting in delivering basic healthcare services in humanitarian situations in Uganda, Zambia, and resource-scarce pastoralist regions in Kenya. We are also working with communities to ensure access to safe water, improvements in hygiene and sanitation, and ensuring children are accessing quality education. We recognize the need to provide evidence for practice and policy and have embarked on growing a portfolio of high-quality health research projects in Kenya, and we are also testing and strengthening the use of health innovations in partnership with internationally recognized research leaders such as the Institute of Health Metrics and Evaluation (IHME), University of Washington, and grant-making organizations such as the Grand Challenges Canada. Our long-standing experience in managing humanitarian operations and logistics through multi-sectorial refugee programs in South Sudan, Uganda, and Zambia has delivered support to over 500,000 refugees since the early 90s under a strong partnership with UNHCR. Our approach to this work is unique, holistic, and aims to nurture self-reliance amongst refugees and their host communities by offering long-term solutions beyond humanitarian assistance. We are working to secure livelihoods of the communities we serve by working with farmers to increase food and livestock production, enhancing markets and addressing challenges to climate change. Our work in this area, including working with refugee setups, has led to significant improvements in household incomes, and people can now afford to take their children to school while fulfilling life's other needs. We work hand in hand with government and other development partners while facilitating communities to play a lead role in their own development by providing technical assistance, supporting setup structures, training, and mentorship. As we celebrate the last 10 years milestones since becoming an African-led regional organization, our new strategic plan for 2014 to 2018 charts the direction our work will take over the next 5 years with a renewed commitment to supporting communities to attain better health and livelihoods. We will remain focused on delivering high-quality interventions backed by the track record we have built over the years, while embracing innovating ways of working to tackle both old and new challenges. We aim to generate value for the communities we serve, our partners, and our staff. We recognize that we will only be able to do this through the partnerships we have nurtured over the years and the new ones we will cultivate moving forward. We take this opportunity to acknowledge the unwavering support of our many supporters, such as UNHCR, UNICEF, WHO, FAO, UNDP, the European Union, the South Sudan Multi-Donor Trust Fund, our bilateral donors such as USAID, the German government through Bread for the World, EED, AAH Germany, Canadian Grand Challenges, and the private foundations including the Bill and Melinda Gates Foundation and the international NGOs including JAPIGO, MSH, JSI, and the Norwegian People's Aid. We are building our next phase of work on this foundation, and we believe that you, our supporters, will continue to journey on with us. You have shown your commitment and trust for what we do, and we will prove ourselves even more worthy of your support.